Hi, I'm Evelyn, your personal therapist and yoga instructor, and I have a prolonged concussion. So today I'm going to talk to you about persistent concussion syndrome or post-concussion syndrome, the symptoms that entails, the mental and psychological aspect to the condition, and recovery timeframes. So getting straight into it and just wanting to share a little bit about my story. My head injury occurred as a second injury about 12 months ago. So I had a serious injury and laceration to my forehead as a teenager, and then this couple of decades later I've been hit in exactly the same place, and what followed was a cascade of many neurological symptoms. So some of those symptoms included headache, neck pain, and they call it whiplash associated disorder. So a whiplash, but those symptoms carry on for a long time. The vertigo, balance problems, really serious fatigue, balance issues. I had 3 falls in the first 6 months. So just walking the dog and just next minute I'm on my ass. Now, coming from an advanced yoga practitioner, that is very unusual. So there was definitely something going on in the vestibular system during that time. So these rushing pressure headaches. So I would roll over in bed and then I'd get this rush. It would feel like blood and pain, feel like my head's going to explode, and it'd peak and then it'd like come down again and then settle as a dull headache. I've had a persistent headache and neck pain pretty much for 12 months now. So the levels of pain do fluctuate, but it's pretty much always there. And I think over time you do adapt to that as well. So we've got the nausea, the vertigo, then there's the brain fog. So at a time when my neurological symptoms were at their worst, my cognitive symptoms became quite bad. And it gets really quite frightening because you start to feel like you're losing your mind. So brain fog is literally, there's no other way to explain it. And I think until you've experienced it, it's hard to imagine, but it really is kind of like you're in this world where everything's misty and you feel slowed down, kind of like you're swimming through mud or trying to run through water. And just you can't think. Like, I couldn't think what was next. Even just a simple thing like making a coffee, I might go to the fridge and stop and think, why am I here? Or I'd get the milk and get halfway between the fridge and the kettle and think, what was I doing? So some really quite significant cognitive symptoms going on there as well. And then what can happen is sometimes with this condition, it is known to evolve as opposed to resolve. And so that's where we need to be really careful. So I was pushing quite hard and also being pushed by all the players involved. And I guess that's a whole other scenario, the work cover aspect to things and workers' comp, which I can talk about in another video at another time. But I was pushing and being pushed. I just started a new job and I had a new responsibility that I was really keen to prove that I was capable of delivering well. And I just started that when I got hit. So it actually took me a while to really come to terms with the fact that, no, you're injured, you need to slow down. So over time, I just kept pushing for recovery and pushing for recovery. And then eventually I burnt out. So when I burnt out, things got really bad. Like, I was literally on the couch all day, every day for it's around 5 weeks. So sort of after about 4 weeks, I was able to sit on the couch most of the day. But one thing I did every day to make sure that I didn't completely crumble and become a permanent couch potato was I forced myself up for a walk once every day, sometimes twice. I tried to do it twice, and even just for 10 minutes, just so that I was saying to my body, like, we are going to keep moving, we're going to keep going. So that's just a bit of an overview of the symptoms. Some people's symptoms are way more intense than that and way more out of control. Some people can't walk by themselves just because their body, their vestibular system has lost touch to such a degree with where the body is in space. They can't even walk without it without falling over and need someone to assist them. That's just one example. The symptoms can get out of control. So in terms of that mental and emotional aspect, it's a really fine line between, is the concussion itself causing like anxiety, depression, or is the situation of having this condition causing depression, anxiety, and other kinds of mental anguish? I think it's a little bit of both. And this sort of comes back again to tying into what is a prolonged concussion. Most people, so it's like 70% of people will recover in 3 weeks, but this 20 to 30% of us do not, and we get these prolonged symptoms. So from a physiological perspective, the brain inside the skull gets hit, and there's some shearing. So the brain shears against the skull, and it causes a disruption to the nervous system. It is an invisible condition, and I think this is the biggest aspect of the mental and emotional side of things. If you have people in your life, and it's very common that people do, who kind of get over it, they get a bit sick of it, like as if you, the person suffering from the condition, isn't over it. We are over it too, I can guarantee you. But it's really hard for people to understand. Even GPs, even your clinicians and your practitioners can get to a point where, well, they can't help you anymore, and they feel helpless, and they sort of dismiss you as well. It's worse when family members do it and loved ones do it, but it really does happen, and it's really just this lack of understanding. We look normal. I look normal. I look my normal self. I look healthy, and I look like my normal energetic self. But I'm not always like this, and I'm not working full time at the moment. I can only handle part-time hours. I can only do this right now because I've got some time off work completely at the moment. Now, that wasn't my choice. My workplace made that choice. But I'm just saying, like, these types of things can really impact somebody's sense of worth, their sense of well-being, and because it can completely derail your life, there really has to be a big shift in your attitude in terms of acceptance. And it did take me a while to get there. When I burnt out, I was in a very dark headspace. So we could say that I burnt out because I was in a dark headspace, or we could say that I got into a dark headspace because I burnt out, but definitely a combination of all things. Having these symptoms and other people not seeing them, so me constantly having to talk about it all the time, was really draining for me. And being questioned and queried, and because it's fluctuating, like the goalposts are always moving, people can have a tendency to start not believing you, or get sick of hearing it, or just not want to deal with it or with you anymore. So this can have all sorts of impact on your self-esteem, your confidence, your self-worth. So I started to lose a lot of confidence with my patients because I was in a hospital, and I was forgetting things, and like to a pretty significant degree, to a level that I shouldn't have been forgetting things or missing things. And you know, that was a big worry to me. So I was starting to freak out because I'm like, am I losing my mind? Have I lost my mind? Do I have a permanent cognitive deficit? So that's where your anxiety comes in. So it's really not necessarily one comes into the other, but one feeds off the other. So my shift in acceptance actually came, so after I burnt out and I just started to get a little bit better, I went away. I went to California and got some treatment. It was amazing. I went to True North Health Center. This health center focuses mostly on dietary changes. They deal with chronic health conditions that are related to inflammation. So concussion is literally inflammation of the nervous system. So it doesn't have to just be diabetes or cancer or the sort of more obvious inflammatory diseases. concussion is an inflammatory condition as well, but it's of the nervous system. So that's why it's much more complex, because when it comes to the brain and the nervous system, we don't still know everything that there is to know. And there's so much variation between individuals. But I went there and saw some amazing doctors. They're naturopaths there, an amazing holistic program, got me on an anti-inflammatory diet, which I mostly adhere to still. It's definitely made a difference. So that, in combination with some other treatments, have definitely assisted me with my recovery. So on top of that, just moving on to timeframes and rehab. So I've engaged in lots of different rehab, and again, that is another video for another time. Rehabilitation is very different between clinicians, and it's very different between countries and states. So that is a whole can of worms of its own. But in terms of timeframes, at the moment, a 12 to 24 month recovery is considered as an early outcome for a prolonged concussion. So if you're not better within 12 months, that really is still considered early days now. So this is just to help give people a perspective. You're probably in for a bit of a long haul if you're not better after a few months. So, and it's time to accept it, because the sooner that we can accept it, then we can start moving forward and just taking those small steps that we need to take. Some people will have persistent symptoms for 5 years, even 10 years. Some people will always have some symptoms. So that in itself can be a very, very daunting concept. And I had to learn quite early on not to focus on that I really just needed to focus on the less distant future. So I guess, as they say in the AA world, one day at a time, but also I guess even 1 year at a time. I'm looking out to the following year where I'm saying, okay, I can't work full time, probably not for another year. And I've accepted that it has taken some strategies, and I guess that's where some of my yoga and other things will come into play on this channel. But getting to that point of not trying to think too far into the future, and just enabling myself to go through the process step by step and really embracing it and owning it, but also not falling victim to it. As soon as we fall into that victim mentality and we start to become helpless, we're also going to drastically reduce our chances of recovery. Now, if rehab can't get us fully recovered, there's compensatory strategies, and then after that there's aids. So this is where my occupational therapy skills come into play as well, where you can make lifestyle changes and set up your environment to cater for your condition, to enhance your functioning and enhance your ability to still do things the way that, as much as possible, the way that you used to, with the assistance of whatever it is. And that could be in terms of, it could actually be physical aids, like props and aids that help you do certain exercise around the home. Glasses, I got my prism glasses here to help rehabilitate my eyes, things like that. But then the compensatory things can be, okay, I need to change the way that I do my schedule. I need to change the type of work that I do. So I've had to move out of the hospital. It is too sensorily demanding. It did take me a long time to get my head around that and to accept that and to adjust to it. But I have gotten there. And then looking at, okay, now how can I formulate my life and my work life in order to allow me to perform at my highest with this condition as it is now, with the positive belief and attitude and hope that we can improve it over time. So this feels like it was a reasonably long video, and I think that that's a pretty decent overview of post-concussion syndrome. Come back and I'll be talking about other aspects of concussion and other mental health and wellness conditions in my future videos. I hope you enjoyed the video. If you did, please like, and subscribe if you like the channel, and I'll see you next time. Bye.